Hey, we are here with Cindy Santos Mendoza with West Compass Insurance, and I'm delighted that we get to have her assistance in mapping out some of the basic questions, most of the questions that I get offered all the time. And Cindy and I share something very similar. You don't know this, Cindy, but we are both California State University alumni. You are in Long Beach for international business and marketing. I graduated from Northridge, and my degree, do not laugh, is leisure studies and recreation and gerontology.
I love it.
I knew you were going to laugh.
I love it.
And we share a common value of helping people with their health resources and their well-being. And so I'm delighted to have your assistance here. I'm going to pull up my questions on Medicare options that I get asked a lot. So, Cindy, tell me a little bit of how you got into what you're doing. Like, what is it that you love about it?
Well, my background usually for the largest part of my career has been in marketing. I've worked in corporate marketing for quite some time. My husband has been in the Medicare world for almost 16 years. And so inevitably, I have been helping on the back end of his journey through, helping communicate better with, his prospects, helping, with his sales approach, providing, my insights. Although, that usually we ignore those that are closest to us, right? So there it speaks of the law of familiarity, everything that I usually tell my husband. About 2 or 3 months later, he'll hear by somebody else and come with a great realization that, oh my God, dude, like really. So for a very long time, he's been asking me to come into Medicare and health insurance. And my real passion has been, although, I've worked in the marketing space, my real passion has been in the non-for-profit sector. So even when I work for corporate America, I actually manage a not-for-profit organization for that corporation. And that was the true passion. I absolutely love helping. There is no better joy. It's like, your heart is racing when you are able to help individuals realize that something that is very complex can be put into much smaller, easier to understand, leave all the fluff out. So we did that while I was working for First American Corporation in helping individuals, get into homes, right? So we did a lot of the outreach for new buyers. Then I moved into the education sector, and we worked with, I worked for a couple of years with a non-for-profit organization that helped students, low resource, but very high potential, get into, elite universities. And help them discover the love for STEM, right? Science, technology, engineering, and math. And so we got to partner with great universities here in California. And it was just, it really, truly is a joy to see, to see that discovery of the, the enlightenment of this, young students when they realize, hey, this is actually possible and viable. Throughout this journey, obviously, my husband has been asking and asking. I'm like, listen, I just don't like sales. It's just not for me. It's not what I enjoy. And in a conversation one day, he says, I think that you have this wrong because I haven't sold a day in my life. Every day, I literally help individuals go in to, a stage, a transition in their life, which is very complicated, often, very scary, which is retirement and Medicare. And that to me turned the light bulb. And I think we in life go through different stages. So I had, fulfill my passion for helping, young students. I had fulfilled my passion for helping families. But I also have, personally, I have a very strong attachment to, to the elder. I was incredibly close to my grandmother. And it's a space that I had wanted to go in for quite some time. So finally I said, okay, you know what, we're going to do this in a what I call a drip system. I didn't want to leave, you know, my job and what I was doing with this non-for-profit with students. Um, but Mary, you and I know that we are the type of individuals that we want to do everything, you know, wholeheartedly, full in. And so within a month and a half of this drip system, I was already knee deep, and I thought, okay, if I'm going to do this, I have to do it. You know, I have to put my entire focus. And that's how I came into Medicare, just with a completely different perspective of not how your traditional sales approach happens, but what can I do to just simplify this transition for seniors who already are, you know, approached by so many trying to sell them, to scam them, to take advantage, to, you know, so in their view, they're very protective of how much information they share. And it's just really coming from an approach of, I am not here to sell you anything. I'm just here to help you through this transition. If I can help you understand how it works, then I know that, you know, you are better off in your journey. And therefore, you know, we create a bond and a trust that, again, that is what lights my heart every day.
So Medicare is for people that are 65 and older, right? Who else is eligible for Medicare?
That's correct. So Medicare eligibility, you have to be 65 years or older, or if you have been, you know, under disability for 24 consecutive months, you can actually qualify for early Medicare as well. Individuals with end-stage renal disease and individuals with Lou Gehrig disease also qualify for early Medicare.
Okay, thank you. And what does Medicare mean?
That's a great question, Mary. I love it. So Medicare, and often individuals confuse Medicare and Medicaid, right?
Yeah.
So Medicare is a federal insurance for individuals, typically, of course, with those exceptions that we already talked about, but for individuals that are 65 years and older. So the idea was, hey, helping you know, helping citizens through that transition into, you know, their retirement. That was, you know, the main purpose of Medicare in providing, you know, the type of health insurance that they needed as they age. I mean, and we're all there, right? We need different things as we continue to age. We usually are going to have to go to the doctor a little bit more often, and the last thing that we want is to have a concern about how viable it is to cover your medical expenses. So Medicare, again, federal insurance, you know, a federal health insurance, and then Medicaid, which is the other part of it, is a state insurance. That's the main difference between the two. Medicare is federal for 65 years of age and older. Medicaid is state, and it's usually, you know, based on income. There are four main parts of Medicare that is important for individuals to understand, because Medicare is not just, you know, the insurance, but it's comprised of four different parts, two of which is what constitutes original Medicare, right? So that will be your Medicare Part A, that's your hospital coverage, and Medicare Part B, which is your medical coverage. Those two are the only thing that you're going to get from the federal government. You often hear about Medicare Part C and Medicare Part D. Those are provided by private insurance carriers. So that's the main difference. Is you will have four parts, two that are provided by federal insurance, and then the other two that are provided by private insurance.
And then what are the private insurance that someone has to acquire for you to have full coverage?
So under Medicare, under original Medicare, there's a lot of gaps. There's deductibles. There's co-insurance. So sometimes, you know, original Medicare may leave someone with a lot of out-of-pocket expenses. So therefore, you have this private insurance carriers that come in and say, hey, we can offer coverage in one of two ways. We can actually help cover those gaps, right, that original Medicare has, so that, you know, you're not left with a lot of out-of-pocket expenses. That's typically what is called a Medicare supplemental plan or Medigap policy.
Okay.
And then we have on the other side what is considered a Medicare Advantage plan, right? So Medicare Advantage plan basically covers all or bundles all of the other parts of Medicare. So that will combine your hospital, your medical, and your prescription drug plan all in one. Usually also, of course, you know, offering additional benefits that are not offered by Medicare. So all of those commercials that you hear in TV, about dental and about transportation and gym membership, they're talking about Medicare Advantage plans. So that's usually how the private insurance carriers will come in. One other important thing to note is when you decide on the path of original Medicare with a supplemental plan or Medigap policy, you still need to purchase additionally a prescription drug plan. It does not come bundle like the Medicare Advantage does. So in essence, you create your own bundle. You'll have to attach your dental, you will have to attach your vision and your prescription drug coverage. And usually, Mary, the next question that I get asked is, why would anybody do that? Like, why would I choose a Medigap policy if I have to, you know, put all of these puzzles of or pieces of the puzzle together? And the answer to that is the biggest advantage of a Medicare supplemental policy is that under original Medicare, you do have the freedom to see any doctor, any specialist, any hospital, anywhere in the United States. So it does not provide you with the limitations that a Medicare Advantage plan may have. And there's a huge difference between a supplemental plan and a PPO plan. And this is something that I constantly try to educate individuals, right? Under a Medicare Advantage plan, you have an HMO, right? A health maintenance organization, or a PPO, preferred provider organization. If you are under a PPO, the assumption is you have a lower cost if you stay in network, but you have higher costs if you go out of network. So you have flexibility, but comes at a higher cost. Under a supplemental plan, the best way that I can describe it is if you go on vacation. So you said that you were studying leisure. I love that. If you go under let's say a cruise, or you go to the Caribbean and they say, hey, do you want to have the all-inclusive, right? Do you want to not have to, you know, penny and dime for every time that you go and get an additional Coke or an additional, it's kind of like the same way with the supplemental plan. You are paying a little bit of a higher premium, right? And depending on the plan, because there's many different plans, but typically you pay a higher premium to not have to worry about a copay every time that you go into the doctor. So there's a lot of unexpected when it comes to health insurance, but that gives you that protection of, all right, if I have deductible, I meet the deductible, and then I'm covered 100% of the cost.
Oh, excellent. And when can someone sign up for Medicare?
So there are different enrollment periods. In fact, there's 5 different enrollment periods. The very first enrollment period that anybody will come when you first turn 65 is called the initial enrollment period. And that is typically the only time that you will get a whole 7 months, because you get 3 months prior to your birthday month, you get all of your birthday month, and then you get 3 months after. Policy always starts on the first of the month. This is something that I get asked all the time. Oh, my birthday's on the 23rd. So is that when my Medicare starts? Nope. Your Medicare insurance starts on the first of the month. Now, a caveat is if your birthday is on the first of the month, then you actually qualify for Medicare a whole month earlier, right? So if you happen to be a July 1st effective or July 1st birthday, you actually qualify for Medicare on June 1st. So that'll be first enrollment period that you ever have is your initial enrollment period. The next one is typically the one that we always hear about, right? So annual election period, October 15th through December 7th. This is the time of the year, just like with an employer group coverage, where you get to make any changes to your Medicare policy, review your medications, review if you are still satisfied with the Medicare Advantage plan. If you have a supplemental plan, you want to move into a Medicare Advantage plan, that is the time to do all of those type of changes. Third one will be the open enrollment period. And the open enrollment period actually was added in January 2020. And it's just an additional enrollment period that happens January 1 through March 31st for individuals that have a Medicare Advantage plan. And it allows them one change in that time from a Medicare Advantage plan to another Medicare Advantage plan or back to original Medicare. And, this typically has been very beneficial for seniors that have been a victim of fraud, right? So because the annual election period happens October 15th through December 7th, but it's not effective until January 1, many Medicare recipients were showing up to their doctor's office just to discover that they had been switched over, either without their knowledge or tricked into change into a policy that their doctors did not take. So that open enrollment period, again, it's not intended to be another annual election period, but it's just a protection, for individuals that are allowed to make that one change. And then, of course, you have a fourth one, which is the general election period. And that general election period is for individuals that did not take Medicare Part B or Part A when they were first eligible and didn't have any other reason that they saw that there was a premium. They're like, I'm healthy, I'm not paying this, I'm just going to bypass Medicare. And 4 or 5 years later, they discover, well, actually, I may need to have medical coverage, right? And so they'll have to wait until that general election period, which coincides with the open enrollment period. So it's also January 1 through March 31st. And so so if they realize that they need insurance through October, November, they will have to wait until the first of the following month. And then last but not least, there's a special election period. This special election period covers a couple of things. Number one, individuals that may still be working, right? And in this, by the way, if there is one nugget, and you have asked me in one of the other questions, one of the insights, I'm going to give you the insight right here, because this to me is the most heartbreaking misunderstanding in Medicare. If you have employer group coverage that is credible, what does that mean? Credible means that it has to be equal than the coverage that Medicare offers, which means it has to have hospital coverage, medical coverage, and prescription drug coverage. So as long as your employer group coverage provides credible coverage, you do not have to apply for Medicare Part B. Many individuals are being told that they have to apply for Medicare Part B because otherwise they're going to have, a penalty, and we'll talk about that briefly. And this is simply not true. If you have employer group coverage, there is no need for you to apply for Medicare Part B. I have had, a number of individuals that, are retiring at age 70, 75, and they have been paying for Medicare for 5, 10 years.
Wow.
And it just breaks my heart because this is lack of information or misinformation. So
Wow.
that special election period is the time that it allows them to, if you're retiring, if you are moving from one state to another, right? If you have a life-changing event, in other words, that special election period allows you that time to enroll in Medicare.
Wow. And they can do that at the time of that life change, correct?
Correct. So
Yes.
they typically will have about 60 days from that life-changing event. So one of the most common that we deal with is retirement.
Mhm.
And the other one is, moving. When individuals retire now, they feel like, well, I'm ready to downsize, and I want to move into, that nice beach property that I have been dreaming about my entire life, and it allows them that change. When someone is in that situation, they want to move and use that special election period. My recommendation usually is go through your move first, then, we'll do the change. Because what ends up happening is you typically are going to go back and forth in that move, and you have to establish care with the new primary care physician. You have to establish, with the new medical group. And so that's going to take a little bit more time. You want to have that coverage in that stressful time, then we can deal with that life-changing event.
Fantastic. What states do you serve, Cindy?
So as you mentioned, I am in California, and I serve right at this moment another 4 states. So we cover Arizona, Nevada, Colorado, and Texas. Not by coincidence, just simply our clients moving out of California typically move into those states. And so that's where we're contracted right now, and expanding as necessary. We are part of a larger organization nationwide. So anybody that needs Medicare and wants to, find a reliable agent, we're always happy to, provide you with an agent that we trust and know in any of the states that we're not in.
Well, fantastic. As we wrap this up, is there any other, I got to share this strategy or this insight, anything that comes to mind? Or, we covered quite a bit of wonderful details to help people.
Yeah. So I think a couple of things. Number one is that often Medicare eligible individuals are hesitant to working with an agent, and they feel like, I'm just going to go in and find the information, then I'm going to call the carrier. I'm not so sure that I want to work with this individual, or I feel like I'm in a cell-C, environment, and I don't want the pressure. My big recommendation is find an agent that you trust, because the agent is going to come with a wealth of knowledge on the different plans that are available. Why is there a specific, path that we follow, when we're trying to pair an individual with the right policy? So just like when you try to find the right car insurance or home insurance, right? Under health insurance, and Mary, I know that you know this, everyone's health and needs are unique to them.
They are.
So just because your neighbor has this great carrier and they love it, it may or may not be the right fit for you, right? So if in the educational seminars that we give, and we provide those virtually and in person, typically when we go to talk about Part D, and we actually did not talk much about that today, but Part D is your prescription drug coverage. Usually the first question that I ask, because Part D is very comprehensive, I will go in and say, by a show of hands, how many here are not taking any medications, right? And then usually you may have one hand, right, go up. The point of that is that the medications are going to drive the selection process for your plan. So it is important for you to know, right, which plan is the right plan for you. Why? Because a prescription medication that may be, and again, a lot more information on tiers of coverage, on stages of coverage, but basically under Medicare, you have one of 5 tiers under the prescriptions. One medication that is a tier 2 under one plan may be a tier 3 under a different plan. And the difference in cost may be significant to that individual.
Interesting.
So again, align yourself with a agent that you trust. Number 2, when in doubt, please ask.
Yes, I agree.
Please ask. When in doubt, please ask. There's no shame in asking. Again, in one, and I think that comes with generational pride of, I should know this. And I tell my clients, because you're like, I have individuals that come in. I've served doctors. I've served, no joke, a NASA scientist, and it was like, this is not rocket science. Why don't I get it? And I laugh. I'm like, listen, to you, it may be hard because this is not your expertise, right? If you try to ask me how to put together, a rocket propulsion, I would be lost, right? So each of us have our a set of expertise. There's no shame in asking. Ask, align yourself with someone that has the knowledge and ask. And I would say number three, please, please, please don't ever give information over the phone from someone that just calls you because they're calling from Social Security or from the health department or from, even if they say that they're calling from your carrier to confirm, right, your coverage. I would say hang up and you initiate the call. Unfortunately, scammers these days, have gotten very savvy. And they have access to a lot more information than you will think. Your birthday, is out there. Social Security, believe it or not, a lot easier to access than you think. So typically they will need your name, your date of birth, and your Medicare number to switch it from one plan to another. So please be careful, with scammers. That is my biggest fight, is just unscrupulous individuals just trying to take advantage. And I've dealt with that. So I would say just that, be aware. And the other thing is, listen, if your plan works for you, don't let anyone, force you into this belief that you have to change every year. A good insurance agent, number one, will find the right plan for you. Number two, will be proactive in letting you know whether there are better options for you or not. So don't feel pressure. Ask, and always, again, Mary, you're a great resource for any individuals that may have questions. And we, as insurance agents, you manage a lot of individual and group. I manage a lot of Medicare. We help each other. I have the resources to know where do I go when I don't have the answer. You have great resources to know where to go where you don't have the answer. So I would say that those will be my top insights.
This is fantastic, Cindy. Thank you so much. I know you've helped a bunch of people, and have a great rest of your day.
Thank you so much for the opportunity. Great talking to you as always.